Hi, this is AINeuroCare Stroke and Epilepsy Specialist. Now we're going to talk about how to be a businessman, right? That's what the physician needs to be. Look, as I told you, there are different kinds of hats that physicians can wear. In independent practice, technically, a physician is a businessman. They're running a whole business. A clinic is technically a whole business. And you need to understand different aspects of it. The first and foremost is who's happier, right? Are employed physicians happier or self-employed? It's both. About 72% and 73%, either one of them, physicians who have chosen that particular pathway are happy with that pathway. People can change, of course, from one place to another. There's nothing wrong with it. But what I'm saying is that happiness is not truly a factor in terms of it because people do choose carefully in the first place. But you need to understand what really goes into it. For me, the most important thing is that who really brings more value to the healthcare system and the patients. Interestingly, we would have thought that a person who's belonging to a large system can produce more value, but that's not true. Independent, especially private practice, can produce lower per beneficiary cost and lower 30-day readmission rate as well, because they have consumer driven. They wanted to make sure that they're running a successful business, and therefore their care is truly driven, and they can adjust their particular time needs per their needs. For example, if the patient just got discharged, they can allot their own time because they're their own bosses. And therefore, when they're their own bosses, they can move things around a little better as compared to a standardized, systemic fashion where they have to follow a regimen, a regulated approach. That may be one of the reasons, but at the end of the day, the data clearly suggests that independent physicians are better for the patient and the healthcare system. They do end up creating less readmissions as well, which is very, very important. And that's how we're going to move towards value care system. And we're going to see that readmissions and also avoid hospitalization. Remember the future of hospital when we talk about financial considerations? This decade is all about preventing admissions, and they are better at preventing admissions as well. Now, who earns more money? Well, clearly, the person who controls their own more finances and controls end to end is going to earn more money. No questions about it. However, it comes at a lot of more responsibilities as well. That doesn't really control for the time you have to put in for administrative tasks. So I think it's a wash. To be honest with you, employed physicians are better off in terms of the amount they earn to the time they spend. But it's a wash at the end of the day. You do have different kinds of responsibilities that you have to take care of. Payroll, like who thought about payroll, right? If you're an employed, but like I know I need to payroll. So those are the kind of things that people who are not are employed do not understand the processes, and we're going to come to that in a minute. Now, clearly, what do hospital systems want? Hospital systems want to employ you. Why is that? Because you generate revenue. Again, there's a difference between revenue and a gross profit. They're not talking about profits here. Revenue is what we're talking about. That means the amount of activity that you can generate. On an average, $2.4 million per physician, employed physician, is made by the hospitals. And that's why they want you to be in an indentured employment situation. That doesn't mean it's a wrong thing. Don't get me wrong. This is a fantastic thing because there's a lot less stress. There's a lot more security. Your 401k is there. You don't have to look at it. You just go in, do your work, come back. But at the end of the day, you are also giving up a lot of control, autonomy, and, to be honest with you, money on the table as well. So again, this is revenue, not gross profit. So make sure you have that distinction. But again, at the end of the day, hospitals want more and more employed physicians. And if you look at it, all physicians in general are increasing the amount of revenue they're bringing in. As compared from 2016 to 2019, the amount of revenue that physicians are bringing in are increasing as well. As a matter of fact, primary care physicians have been tremendous. They're approximately bringing $2 million per year for their services to the hospital in terms of, downstream revenue of labs, radiology, now healthcare devices, etc., etc. Specialists are a little lot higher on the scale as usual. That's not unusual, but at the end of the day, they are bringing a lot more revenue as well. As interestingly, if you look at the average revenue that a particular subspecialty brings in and what is the average salary, this is the chart that you want to look at. I mean, cardiology is one of the top performing specialties, bringing in, especially the invasive cardiology, that they are procedure-based specialties are reimbursed better, unfortunately, but it is what the system we live in. And the average revenue they're bringing in is about 3.5 million. However, their average salary they're enjoying is around 600K. And this is, again, sort of things that I wanted to bring to your attention. Not that it's going to make a huge difference in exactly what you're going to choose. But again, when you're looking at a varied of spectrum, you need to understand these things as well when you're making a choice of your subspecialty or specialty as well. If you look at it, unfortunately, independent physicians are losing ground. And to be honest, if you look at the historical trend, the pendulum swings every 2 decades. So in 1970s, there was a huge push towards employment. Everyone was employed, then everyone got into self-employed. Now everyone's going back to employment. And to be honest with you, after pandemic, I'm seeing a trend that, self-employment is on the rise again. But, these trends continue to change. The current trend is that independent physicians are losing ground. As a matter of fact, if you look at from 2012 to 2018, independent employed physicians grew from 43% to about 50%. Same decline went into the independent one. And this was also replicated from Merritt Hawkins to AMA report exactly verbatim. Now, there are different ways to look at it, and I'm being in a C-level executive situation. I do understand the other side of the business as well. But true, at the end of the day, the business of healthcare does depend on exploiting doctors and nurses. And the business of Google depends on exploiting software developers. And the business of X depends on getting more work from their employee and making them more productive as compared to the money they are paying. This is how every business functions. Again, healthcare is also a business, especially in US. I don't know about any other countries, but at the end of the day, in US, it is a business. But this is an extremely important read by Danielle Orphy. Also follow her on LinkedIn, Twitter. She writes fantastic. And this is an important article for everyone to read who are designing their clinical career, because they need to understand what it goes into in terms of, the word exploitation and improve productivity is very different. I mean, I do want to make more money too, but the question really is that if my employees are better productive when they're happier. So therefore, there's always a challenge between those two pulls and pushes. Again, talking as a businessman, but again, if you're just a physician or nurses, then you have to always understand the two sides of the coin. But clearly, pandemic has unearthed a lot of inefficiencies and dissatisfaction, and we are having a lot of exodus in the healthcare with the great resignation going on. Now, business of medicine is hard because you need to do contracting, you need to do a lot of administrative tasks, and the biggest one that is now becoming a huge burden for everyone is the healthcare IT, because more and more increasing requirements are coming in, and then more and more money is being pushed into IT needs as compared to directly taking care of the patients. So you need to be master of a lot of different skills as well, because it's not just about running a business, right? It's not just about payroll. It's not just about hiring. It's just not about firing. It's about 401k plans. It's all about, it's a lot of things that you have to take care of. And more importantly, you have to find the business, right? You have to contract with the healthcare insurance company to make sure you're getting paid. The administrative tax that I talked about, and more importantly, these things are becoming a little bit more complex and more expensive as well. You really have to take care of the whole care delivery workflow. What is, the pre-visit, during the visit, post-visit, and then all the people, all the softwares, all the systems has to flow through that care delivery model through your clinic or your affiliated hospital. More and more devices are coming in, more and more technologies are coming in, more and more insurance disruptors are coming in, more and more competition is coming in. Amazon Care is here now. Walmart is getting into health. So there are different, again, opportunities and challenges that are disrupting this whole field. And therefore, some of the physicians are also choosing to become employed because the business task is becoming overwhelming. Who should you choose to be? It's not something I can answer, right? I mean, this is something that depends on your personality. It is something that you do, like doing it. It is something that you found a good partner that you're going to work with or not. Does your choice of subspecialty requires a lot of large healthcare system dependencies, right? I mean, orthopedic surgery, for example, can open up their individual surgical centers, and they're very extremely successful in it. But neurosurgery is not, because clearly you can't do that. You need a hospital, a neuro ICU, MRI, CT scans, tons of shit that goes around. So there are ways in which your subspecialty is prone to it or not prone to it. I don't think so this will be your deciding factor. It's just important in your knowledge that you understand how these things are going on. And eventually when you are doing contracts, even as an employed physician, there are now ways to become stakeholders, if not stockholders. And in some situations, you can become stockholders as well. Again, these are complicated things, but at this level, I wanted you to understand that this is a breadth of understanding of the healthcare business side, and it is extremely complex, and I'm learning constantly about it and being amazed about some of the stuff that goes on and some of the shit that goes on. Anyways, it was a pleasure talking to you. In the next stop, we're going to talk about if you want to be a scientist. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.